my name is Tamika Monday, also known as Nurse Monday. I want to give you my presentation today on decreasing loneliness experienced by patients. Reasons for it is my subtitle here, to lower risk of morbidity and mortality. But first of all, let me tell you a little bit about myself, and it'll kind of bring you into why I chose this topic. I've been a nurse for about a total of 12 years, combined LPN, then progressed into my RN, and now, of course, at Central Columbus State for my BSN. I started out in the medical field, as most nurses do, or most of us are advised to do. I really enjoyed the medical field, but with having a family, I ended up into psychiatric care. And I thought that psychiatric care would not be challenging enough for me because I love my medical skills like a lot of nurses do. I think we feel that we achieve more when we work with our hands and our minds. Psychiatric care, especially forensic psychiatric care, was a lot different for me, and it was more challenging for me than I thought. And actually, I come to love it. I love working with the mind, and I love that it is still a challenge to the medical profession in itself, and that a lot of the things that we do are still in that experimental phase. For example, you have a patient that's got an infection, we give them an antibiotic, we watch it progress, or we watch things not get better, and we do what we need to do to change that. But think of that with the mind. It's completely different. When you're trying psychotropic medications and seeing where that leads to, you really have to watch the patient in a different way. We can't watch medical things play out in that way as far as vital signs and warmth to the skin and draining ulcers and that type of thing that we're used to. With the mind, you really have to watch the patient. You have to know the character. You have to get to know them. And a lot of the medical profession does not allow for that. Even in psychiatric care, there's not enough time to spend time with patients because paperwork kind of is overbearing for most of us in the nursing profession, which kind of leads me to the loneliness aspect of patient care. I have a certain patient that I took to take care of. She was diagnosed recently with Parkinson's disease, and one of her biggest complaints is always, and trust me, she's got a lot of morbidity going on, but a lot of her complaint is being lonely. And what can we do for her? We try to encourage her, we take her to groups and things like that, but she still experiences loneliness. She's on a unit with 20 other individuals, 20 of her peers, and she still complains of loneliness. She goes to groups, she still complains of loneliness. But I'll tell you the difference between her being lonely and her being alone, and that kind of gets confused. But I'm going to go on into my presentation here. What is loneliness exactly? Which is what I was just talking about with this patient. Loneliness versus being alone. They're not the same thing. Loneliness, as described by many people, is a perceived feeling. I kind of highlighted feeling of being alone. It is not something that I can tell you. You over there, young lady, you are alone. But can I tell you if you feel alone? Just because you're alone does not mean you feel alone. So it's a perceived thing. It is what the patient says it is, almost like we feel about pain. You cannot tell a patient if they're having pain on a scale of 0 to 10 and say, you look like about a 5. And even though you say it's a 10, I'm going to give you a 5. That's not how it works. If they perceive the feeling of being lonely, I don't care if they're surrounded by one person or 100, then they are lonely. We have to trust them at that word. But going on with the definition, it is a perceived feeling of being alone, being cut off, not having someone to love or care for them. Unfortunately, that is kind of epidemic around here, in America especially with electronics and things like that. Even children become isolated. It is not the same thing as being alone, as I said before. So why should loneliness be addressed? In other words, why should nurses care about loneliness? I mean, there are no medications that can treat loneliness. Is loneliness a medical diagnosis? No, it is not. Is loneliness a psychiatric diagnosis? No, it is not. However, depression is. However, mood lability is. But loneliness is not. It is a perceived thing. It is not a diagnosis. So, again, why should nurses care? Let's talk about that. Concerns for mentally ill patients and loneliness. I talked about mentally ill patients only in this segment because of the feeling because I work with mentally ill patients. Mentally ill patients experience loneliness at a higher rate than usually the average patient does, because they can experience physical health problems that can cut them off from society, and also mental illness, which also has a stigma in society, which cuts them off as well. Let me read my quote here from Ascertain 2015. Human closeness is a fundamental to our mental well-being. I have fundamental in blue and bigger than the other letters here for a reason, because it is a building block of our well-being. So we know we need food. We know we need water. We know we need shelter, but a lot of us do not know that we need one another. Without it, any number of pathologies it could plague us. So what's that saying is that loneliness causes us to become ill, become sick, less healthy. So that is one of the reasons why nurses should care about this. A nurse is going to be concerned with, number one, physiological effects. That's the physical body. What does loneliness cause in the physical body? Well, could it cause things in the physical body? Absolutely. Physical pain. Loneliness can give the body the feeling of being in physical pain. As a matter of fact, the brain reacts to loneliness as in physical pain. It kicks in the fight or flight mechanism in the body. So your body is trying to defend itself, it's trying to get away, even though you may not look like it, your body's in a stress mode. Physical pain. Obesity. People that experience loneliness tend to eat more than people who are not lonely. So, of course, when we talk about obesity, most nurses know we're about to cascade into these things. Cardiovascular, immune system, and death. Cardiovascular, well, you're getting heavy, so usually we're going to go into that risk for cardiovascular disease, the hardening of the arteries. The immune system. When it comes to the immune system, like I said, the fight or flight kicks in. The body responds to loneliness like stress. When in this mode, the immune system tends to want to fight bacteria as opposed to viruses for some reason. And when it does that, the body cannot defend itself against viruses as it should, which allows the patient, or anyone for that matter, to be more at risk for cancer, which causes death. So here we are at the bottom, which cardiovascular disease, heart attack, that sort of thing, it all leads to death. So a lot of these people who feel, patients who experience this loneliness can wind up having a premature death. And we're going to look at these things, but what we don't see, the underlying cause could be being cut off from, or isolated from society and being lonely. Psychological effects. So now we're coming to that holistic thing that we nurses are always talking about. The mind and the body working together. Depression, anxiety, alcoholism, substance abuse, suicide. We're back at death again. When we talk about depression and loneliness have always been linked. Anxiety. Most of the time when we think of anxiety, I know in my field, we're thinking of someone who's hyped up, who's amped up, shortness of breath, they're showing all these kind of signs, but not always. Sometimes people who experience loneliness experience anxiety as well. Alcoholism and substance abuse, we're going to put those things together. The reason for these things, they're more at risk for that is because usually people that experience the effects of loneliness have a harder time combating. Actually, let's put them all three: alcoholism, substance abuse, and suicide. When the mind says, "Okay, maybe it's over with. I'm not, feeling myself. I don't feel wanted." We're feeling that depression. So suicide is unfortunately a lot easier for this patient. Substance abuse and alcoholism is easier to abuse these substances when a patient experiences loneliness. Loneliness alters behavior, which increases our chances of indulging in risky habits such as drug taking, which I just talked about. Risky behaviors, that doesn't have to just be drug taking. Risky behaviors mean just drag racing, anything that you would see teenagers do, that kind of thing, that I'm invincible type of behavior. Experiencing loneliness plays a role in mental disorders such as anxiety, paranoia, loneliness, and also known factors in suicide. So we know it psychologically that loneliness can play a role in a lot of these things that we see that affect mentally ill patients and any patient or anyone. Physical effects. So why do we increase our weight? We increase because our food. We tend to go to food more when we're lonely. Loneliness is tied to hardening of the arteries. It goes back to the cardiac disease. Weakened immune system. I talked about that. The reason for it is because the body chooses to defend itself against bacteria versus viral infections. The increased risk of heart attack comes back to this, the hardening of the arteries, and they're more likely to die from chronic or terminal ill. Research has shown that people who suffer from loneliness are less likely to recover from physical, chronic illnesses and terminal illnesses as opposed to those who do not experience loneliness. Mental effects. Increased risk of viral infection and disease. So that plagues the mentality. Decreased restful sleep, staying or falling asleep. Insomnia is one of the things that plagues a person who experiences loneliness. Insomnia, which can also alter a lot of things. Your health is wise. Poor sleep or poor sleep habits. Increased risk for drug or alcohol dependence, as I talked about before. These are all mental effects. There's more difficulty combating suicidal thoughts. So if a person with depression starts to experience loneliness, even with a lot of counseling, it's kind of hard for them not to fall into suicidal ideation or suicidal attempts, unfortunately. Why should nurses care about loneliness? My big red word here, interventions. That's what nursing is all about. We're on the front line for interventions. What do we do to fix the problem? What do we do to treat the illness? Future interventions to alleviate the health burden of loneliness will do well to take into account our evolutionary design as social species. I took this quote, I like it because of the social species. It goes back to the first quote that I was talking about, that we need one another to combat loneliness. Not that it has to be human companionship. Some nursing homes, they've even found that pets make good companions for those that experience loneliness, or ways to combat loneliness for the elderly in senior or living skilled nursing facilities. Nurses against loneliness. So what is my goal here? Why am I talking about this? What do I want to come of this information? After having understanding of what loneliness does, now nurses can develop plans to avoid or decrease loneliness. We can get involved. Maybe we can go to our administrators and let them know, hey, I've got several patients that are complaining of loneliness or experiencing loneliness. And they already have the risk factors that go along with loneliness. And we need to do something about it, because there's ways that we can improve that patient's quality of life by intervening. Loneliness negatively affects or inhibit interventions that nurses implement to provide treatment for patients. Well, what's the point of me doing things to treat you for HIV? Yes, it's a chronic illness, but loneliness is only going to take you further down. So my implementations or treatment that I'm doing is going to be negatively affected. So we want to get loneliness out of the way. If we can do something about companionship, we increase that patient's quality of life. And who knows, it may be that person's last few months or last few weeks of life, and you've done good there, but you also help to increase the potency of the intervention that you're given to help this patient. Nursing care is holistic. Emotional states should be addressed to provide assessment of mind and body. That's what nursing is all about. We have to create an environment that's conducive to healing. And to do that, we have to think holistically. We cannot treat the body without treating a mind. We cannot treat a mind without treating a body. They go hand in hand. The data. A study of 2,835 women from the Nurses Health Study who were diagnosed with stage 1 to 4 breast cancer between 1992 and 2002 were assessed for social networks and social support at multiple intervals. So they were basically studying women with cancer, a lot of them, over 2,000 patients, to see the comparison between those with social support and those without. Compared to those who were socially integrated before their diagnosis, women who were socially isolated had a 66% greater risk of death. That's significant. That's significant when we're talking about saving lives. 66% is worth the involvement or worth the assessment of addressing loneliness. So how do nurses assess loneliness? A big word here, subjective. At the beginning, I told you that it is a perceived feeling. It is what the patient says it is. So if they say they're feeling loneliness, then they're feeling lonely. It is not something, well, you know. Mr. Henry in room 103 has 7 family members in his bedroom every day. I do not understand how he could be lonely. It's not up to us. It is their perceived feeling. Just like pain. Loneliness is perceived. Ask the patient if they are experiencing loneliness. That's how we assess it. That's how we're going to find out how that patient is feeling. We simply ask. How do we know they're having pain? We ask. It's not going to be like if you're having shortness of breath. I can't see the retraction of the chest. I can't see accessory muscle build in. But it's something I can simply ask. I put this little sort of play here together, and I want to use that. I didn't use a scenario or a case study, but I use this because I said it was simple. You just ask. The nurse. Nurse goes into the room. She introduces herself. Hi, I'm Nurse Monday. I do my patient identifier. I check the wristband. I ask the patient their name, their date of birth, and if they're all correct, I proceed. The patient lets me do that. And the nurse says, I will be assessing you today. Is that okay? Patient says, okay. Take my vital signs. Are you having any pain? Because we know that goes with vital signs. Patient says, no, no pain today. And a simple question. Are you feeling lonely, depressed, or isolated? I know I said at the beginning that these are all not the same thing, but I use these words because in the public, they are linked together. Lonely, depressed, and isolated. Those are words that people use, so I would use those words, and I think we can get the meaning. And again, the question was, are you feeling lonely, depressed, or isolated? And the patient responds, my family lives away. It's hard for them to get here. It gets lonely in this room at times. I'm sure if you've been in a hospital, we can all relate to that. You know, you got a TV, you got a remote control, and you got a nurse peeping in on you every so often. It does get lonely. So you got a patient that you're trying to get healed, or you're trying to get diabetes under control and things like that, or any of those things, a patient who has a history of substance abuse, it's well looking at. It's worth looking at. Nursing interventions. So, with all that said, what do we do besides ask the question? We've asked the question, we've assessed it, so what do we do now? What do we do to intervene? Assist the patient with identifying reasons for feeling lonely. Patient said, my family lives away. It's hard for them to get there. It's one of the reasons. He's missing his family, possibly. Or maybe the family comes and they don't even talk to him. They're just there. You know, we can't always assume. Get family involved. If the family's there, get them to do some things for this patient. They're in bed, you know, Mr. Henry, he was talking about needing to shave. I was going to shave him. Would you like to do that? Encourage patients to write and call family. You know, in the mental health facility where I work, that's much encouraged for us to get them to write. Also, writing kind of helps get out some things, some frustrations and stuff, and we have that a lot. Provide stimulating environment. Bingo games in skilled nursing facilities are huge. And where I work too, I've even heard of some facilities getting video games in. Like I said, pet therapy has become popular as well. Encouraging patients to participate in unit and facility activities. So if your facility is having something, how to get them in there. Get them in there and see if we can combat some of that loneliness and hopefully combat some of this morbidity and mortality. That's the whole thing. The reward. What do nurses gain from this? What do anyone gain from this? The long term is that we got a healthier community and society. We got more education out there when we did not of what loneliness does to us. When nurses address it, trust me, if we make it important to them, it'll become important to them outside of facilities as well. Short term. The short term is the facility that you're in, the patient had a better stay there. being lonely is not fun for anyone. It's not really a positive thing. Maybe being alone, if you want to be alone, but being lonely is not. So the short-term goal is maybe the patient just had a better stay. We're not saying that taking care of the loneliness is going to take care of the cancer or going to take care of the lupus. No, it's not going to do that. But in the short term, you may just have a happier patient. They may have a happier stay. They may visit a facility more often. They may come do their treatment when they're supposed to without the fear of having to experience the loneliness. Like I said before, a healthier community. Knowing what loneliness does, we've informed the community, we've educated, and that is a big job of nurses. Educating is an educating tool and combating loneliness. So this is what this is. The whole thing, all of this combined is education for nurses and education for the community. Like I said, that's a big job for nurses to do, and we should take that seriously. But I wanted to bring loneliness to the forefront because it's kind of a thing that's ignored because nurses are so busy now, along with the staff that works with us and doctors, social workers, we're all very busy. We normally don't address loneliness until there's an issue that has stemmed from it. Suicide attempts like that. By then, we're sometimes too late, unfortunately. So this is why I'm bringing this to the forefront here. How intervention for loneliness will affect patient outcomes. The objective for loneliness intervention is to, what are we going to do with this? Enable nurses to implement holistic care. This is to bring the mind and body together. Decrease morbidity rates. This is to hopefully decrease some of this loneliness. If we catch people out in the outside before they come in with chronic illnesses, by decreasing illnesses, we may do some good there. Decrease neurodegenerative diseases like Alzheimer's. Decrease rates of substance and alcohol abuse. If we come back to loneliness, maybe we can cut off some of this alcohol abuse and some of the legal costs that this causes some of our patients. Decrease rates of suicide attempts and suicide. Sorry. And that's my references and that's my presentation. Thank you.